welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we welcome back on the show Miriam Zilberglait. She is an internal medicine physician, and she wrote the Kevin MD article, Physician Suicide, Where Are the Leaders? Miriam, welcome back to the show.
Thank you so much for having me again.
So for those who didn't get a chance to listen to our last few episodes, just briefly share your story and journey to where you are today.
I am originally from Peru. I am an academic physician. I am an associate program director for an internal medicine residency program. So I have 45 residents that are my kids or my family and some extra medical students. I am very into promoting wellness in my residents. I feel like in order to be a good physician, we need to be good people and we need to take care of ourselves.
So you wrote this article, Physician Suicide, Where Are the Leaders? And before we get into that, tell me about how you got so interested in physician wellness.
So again, as an academic physician, I have the joy and at the same time the responsibility of teaching young doctors to try to guide them in the right direction. The challenges that as physicians and as adults we face are big, but I believe that the ones that the residents and medical students are facing are even bigger, especially with COVID now. I don't think that we are providing them with all the education and the skills that they need for this new era of practicing medicine in this country. I feel like providing them with education in leadership, in well-being, and emotional intelligence development will help them to be successful in their personal and also in their professional lives.
Now, over the years, are you seeing burnout in medical students and medical trainees? Is the frequency of burnout increasing over the years that you've been teaching them?
I will say that officially, probably I will not have appropriate data. We don't tend to screen formally. Extraofficially, I will say that yes. And big part of it, I feel like is related with more administrative job instead of human contact. But I feel like it's like students and residents feel this emptiness when they use their time, their energy, and their effort in doing tasks that are related to the computer and clicking buttons and fulfilling metrics instead of being close to patients and having this rewarding feeling of, being in contact with another human being.
Now, of course, you and me, we're attendings and we're certainly familiar with all the bureaucracy and paperwork that's been increasing over the years. But from the perspective of a medical student, intern, and resident, give us an example of what kind of administrative burden they're facing, whether they're in training or even just coming out of training.
Well, they have to be in front of the computer long hours. The notes, the orders, everything happens there. You spend more time really in front of this machine that gives you most of the answers. And you need to click all these buttons so you have the metrics and everything that you have to complete on time. And then the time that you spend with your patient is really minimal and you are exhausted at the end of the day. Beyond that, remember that medical students or residents, they need to still keep studying. We have to do it too, right? But they have the pressure of passing the step 2, the step 3, the boards. So they have also an academic pressure that they need to complete, and many of them, they are starting families, they are getting married, they have their first baby, they have family members that get sick. So it's a big challenge, and I believe that we cannot forget about the financial burden that they have, knowing that they will have to pay for medical school for a long time. So that's something that I feel adds to the pressure.
All right, let's talk more about your Kevin MD article. It's titled Physician Suicide, Where Are the Leaders? Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
So normally, for those that know me, I am a very positive person, and I try to find the light at the end of the tunnel. That's kind of different with this article. I was very frustrated, I was upset, and I was asking myself why. I got in front of an article that was describing the death of 3 resident physicians in one facility in a period of 7 months. And that got my attention. And I started reading the article and then kind of clicking the links and seeing that these cases were not isolated, that there were many cases, one after the other in different places. And the first question that I had was, where are the leaders? How this is so quiet? What are they doing? And I didn't have many answers, to be sincere, and that's how the article started.
Now, in those cases where the residents tragically took their own life, what was the response of their leaders?
It's very interesting. There is not a lot of information there. I will have to say that I am blessed. I never had the personal experience. I know that when I asked my residents and medical students, more than one raised their hand saying that they had a friend or a colleague that died by suicide in the past. I have never been in front of a situation like this, and I don't want to be in front of a situation like this. I believe that we need to focus on preventing these type of things to happen. And in order to do so, we need to create awareness, and we need to understand the type of challenges that we are facing, and we need to start to be proactive. You cannot recover the life of someone after it's gone, and that breaks my heart.
So give us some examples of what physician leaders can do to address burnout, potential behavioral health issues. What are some of these proactive examples physician leaders can do?
I believe that depending the type of leadership, right? Because we will have in a national level, I believe that leaders need to promote the idea that physicians and any other health care provider should have access to mental health support without any retaliation. And that means that none of us should have to put in our license application or our job application that we had or require support from a psychiatrist or a psychologist to cope with burnout or anxiety or depression. That's a big limitation, and that's something that I believe comes from higher leadership. In the institutions, academic institutions, hospitals or medical schools, I believe that we need to foster an environment that is free of discrimination, free of retaliation, where residents or medical students and physicians in general, we feel free to express concerns, where we feel that we belong, that we are treated with respect. And that's easy to say and more complex to get done. But if we don't start educating the leaders, and I believe that that's where we have to start, we need to educate the leaders. We need to educate those that are taking decisions, so they understand that there is a risk. That in medicine, not everything is about metrics, that we need our providers to be healthy, to be happy, to be 100% focused on what they are doing, so we can really help our patients and we can grow the institution where we are working. And I don't think that that's really understood by non-physician leaders in the healthcare system.
Today, we welcome back on the show Miriam Zilberglait. She is an internal medicine physician, and she wrote the Kevin MD article, Physician Suicide, Where Are the Leaders? Miriam, you mentioned that you supervise 30 to 40 medical students, interns, and residents. Now, what are some of the things that you do to check to see if there's any behavioral health issues and to assure the behavioral wellness of the students that you supervise?
So I'm very lucky that in my institution, in a national level, they have a wellness committee. So in the national level, we are working in projects to foster well-being, to try to understand the challenges, and to provide support to the local institutions to be able to create projects, local projects. In my case, in the hospital where I work with my residents, we have a local wellness committee that is run by the residents. They organize activities from parties. Well, now it's a little more complex with COVID. To different type of interactive activities, including painting, for example, or yoga relaxation. So we can have a fun time that promotes well-being and a good positive interaction between us. We are giving lectures and presenting workshops that promote the idea of stress management, communication, prevention of burnout, and recently actually we had a day of movie time, let's call it, where we show them a documentary about physician suicide, and we have the opportunity to have a conversation after that to create awareness. Beyond that, we have a peer mentorship program. We feel like the most probably at risk of having any challenge at the beginning are the interns. So every intern has a peer mentor that is a senior resident that welcome them into the program and help them not only with the academic part or the clinical part, but where to find clothes, who cut your hair, these silly things that are so important when you are coming from another country or another city, and especially when you don't have family. So that's what we are trying to create, an environment that makes us feel that we belong and that we are a family and that there's someone there to support you.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Take care of yourself. Pay attention to yourself. Be nice with yourself. And after you do that, enjoy medicine and take care of the ones that are around you, and try to identify red flags. Don't let things to happen.
Miriam, thank you so much for coming back on the show and sharing your time and insight. And thanks again for your time.
Thank you so much.